Hey y'all, thanks for stopping in. Appreciate you taking time out of y'all's busy schedule, stop in and see what it is I'm up to. Uh, Trying to organize and straighten things up and put things away, and part of that needs to be, before I put it away, I figure I'll show it off. I've done a few wound care kits, boo boo kits type things. This little one will go in the glove compartment of the Brat Buggy. This one will go in the linen closet. It's basically just a boo boo kit. When the GrandBrats are around, let's bring you down here a little bit. Now, I'm not a big proponent of band-aids. The sticky bandage type thing. If you have a wound that's bad enough it needs a band-aid, then it's bad enough it needs to be properly cared for. But they do come in, little kids want a band-aid, so we carry band-aids. And sometimes it will help if you put a band-aid on and then actually tape it on. But a band-aid itself doesn't stay real well. This one has some aspirin in it. All my kits have aspirins. All my kits have all these little mini meds too, just in case there's some stomach stuff, the pink medicine, upset stomach, indigestion, diarrhea, some daytime cold relief. There's an anti-diarrheal. There should be an antihistamine in here as well. Yeah, there's an antihistamine, allergy type medicine. There's also a Benadryl tablet. There's actually 2 tablets in there. For mosquito bites, or you get into something that gets your, sometimes you just need Benadryl. I have 2 packages of sugar and a takeout thing of salt in a little baggie. Sugar, if you're hypoglycemic, one is high blood sugar, one is low. They both have the same symptoms. Sugar will help one and won't harm the other. This is not the best way to introduce it to the system, but it is better than nothing. Some of my other kits I carry cake frosting because it's the easiest thing to use. I do have boo boo bandages, some of these are actually Johnson & Johnson brand. Some of them are probably other brands. Wound care starts with cleansing the area. Probably cleansing your own hands first. So you wipe down with these. And then there's the alcohol preps. Again, wipe your own hands down before, messing with a wound. You can then clean around the area with these. And then these are 2-inch gauze pads. They can be applied if the wound is bleeding a little bit more. You can double it over. You can use the adhesive bandages as temporary tape. They don't work real well, but they're better than nothing. Now we'll get into this kit. This is just a basic, again, more a wound kit. Keep things kind of organized. I have some sterile gloves. Well, not sterile gloves, but rubber gloves. You never know when they're going to come in handy. There's a pen. If you have a bite or something, or even a small puncture wound, and you want to see if the redness is spreading, you mark it. You can actually mark around the spot, and then in 15-minute increments mark where the next spot is, etc. It helps. It helps with your own knowledge, and if you end up having to go to the doctor, you can say, look, this was the occurrence, 15 minutes, a half hour, an hour, and this is why I brought it in, because it just kept spreading. Hydrocortisone cream. It's a fast itch relief, especially for like mosquito bites and stuff like that. Just a cheapy triple antibiotic from the dollar store, Dollar Tree, I believe. Handy wipes, just because, again, if you have a wound, you want to clean your own hands, you want to clean around the wound. Zantac. This is a for indigestion. The hospitals generally give Zantac. At least my hospital does. I have a large box in with my medication. If I'm having bad heartburn, sometimes it mimics a heart attack, I will take a Zantac and an adult chewable aspirin. And then if I don't feel any relief shortly, then I'm on my way to the emergency room. But Zantac, these are just a backup. Cause like I said, this will be in my linen closet. Pair of tweezers, because this is where tweezers should be. There's a small roll of tape. Hand sanitizer, again. Clean your hands anytime you go to touch a wound. I have a cold pack. You break it, shake it, and apply it. This is 2x2 gauze bandages, or gauze dressings, and band-aids, adhesive bandages. Again, we have a bunch of little ones running around. The gauze bandage and tape, or gauze dressing and tape, I'll be okay. Here's a 3x4 inch non-stick, so it won't stick to the wound, gauze pad. A couple of these are large craft sticks. They used to be tongue depressors, but they will work for a finger splint. Two of them together would work for a wrist. This is a very temporary, very basic. I am a super klutz. I use these all the time. I have one of these. There's one in here. There's one in the desk next to my drawer. There's one they're all over the place. I never know when I'm going to twist an ankle, or my ankle will just like turn and give out on me. So I have them all over. They come in handy for other things as well. These are not survival first aid kits. These are very basic, minor cuts and bruises, sprains. I can't believe I don't have alcohol wipes in this kit. I'm going to fix that right now. I got a huge big bag of alcohol prep pads. I don't know why I wouldn't have put them in here, unless I just anyway. This is not a it's not a full-on first aid kit. It is a basic wound kit. If I can't handle it with what's in here, I don't want to handle it. I want to go get professional help. Go to the hospital and get actual medical care. That's just the way I feel about it. Of course, when it happens, I have been known to stitch myself back together again, or just wrap it up with black tape. and keep right on going. I don't know if we can see that or not. But I took that off with a grinder, covered it up with antibiotic ointment, a couple gauze bandages, and some Gorilla Tape. And actually, it was just duct tape at that point in time. It was 30 years ago. Anyway, no stitches, no nothing. It pulled together and it healed. So don't do that. That's a bad thing to do. I should have had stitches with that. I don't know that it would have come out looking any better, but realistically, that's what I should have done. That's it. These two little kits. I have two other kits to show. Those will probably be individual kits, and I don't know if I'm going to do them today or when. I do need them out of here, so we'll see. But let me know what you think, folks. Give me a thumbs down or a thumbs up. Leave me a comment wherever it is y'all happen to leave comments on your internet access device of choice. If you would like to share me around on your social media, that would be fandoculous. I'm up at 380, 381, 82, 83, 81, 79, 80 subscribers. Hello to all you new folks. I appreciate each and every one of y'all. I really do. If you want to check out my Facebook, there will be a link wherever the description is on your access device. I'll also include my snail mail address, a couple other links to things that I don't use. Instagram, Pictogram, Twitter, I think. I don't know what all's in there. Because I don't do it. Love getting snail mail. Whatever it is y'all happen to send. Something odd, something that represents your area, your state, your country, whatever. If your loved ones are nearby, give them a kiss and a hug. Slap them upside the head. If they're not, give them a call. Hit them up on Facebook. Let them know you're thinking about them. Let them know you love them. You may not get another chance. We're not promised tomorrow. We're not promised the next hour. But until I see you again, I hope you all have a fandoculous day. Slunchy, y'all. Bye-bye.